Hello everyone and welcome back to my channel. So if you're new here, welcome to my channel. So this video is gonna be a little bit different. This week is Tube Feeding Awareness Week and I'm going to talk about tube feeding or feeding via tube. So I'm here because of my gorgeous daughter Anaya. Say hi everyone. Hi everyone. So we're gonna talk about your tube feeding journey. Okay? Are we going to talk about that? So even now she's feeding on the tube while we are talking. So here is a tube. And let's get started. Yeah? You can't see her face. She likes to make her head down. So Anaya born full term, but during labor she had brain damage because of placenta abruption. So she got brain damage. So she starved of oxygen in my tummy while doctors did C-section, and when she born without any response, so we had to rescue her, and she was about 30 minutes without oxygen, and we put her on the cooling therapy, which is to make her body temperature about 24.5 degrees, and she was sedated, she was intubated, and from day one she had NG tube. So NG tube is nasogastric tube, which is going through the nose. So it's inserting through the nose, it's going through the throat, and until it's reaching stomach. It was very scary, and we didn't know exactly what's happening. And yeah, but I really wanted to feed Anaya, breastfeed Anaya. I dreamed about it while I was pregnant, but I will breastfeed her. Like, my mind was ready on that. And when she was in coma, my question was how I'm going to breastfeed her, and if she's gonna be in coma for a long time, and if she's gonna be sick for a long time, probably I'm gonna lose that ability to breastfeed her. But in the hospital there was an amazing nurse or midwife, or I don't know exactly who teach me how to stimulate for milk. So she teach me that. She explained everything, so I was doing, and the same day, basically she born in one hospital. In the morning we transferred to different hospital for cooling therapy, and I stayed in the same hospital, and then in the evening, late evening, we transferred me to the same hospital. So in the first hospital they explained me how to stimulate, that I could have milk, that I could express milk. So the same evening when we transferred me to another hospital, shall I put her down because she will be more comfortable? So we transferred me in the evening the same hospital. So when I started to stimulating that I could have milk, and then I believe next day I asked in the NICU nurses how I can do and everything, and the same day my mom, like next morning, my mom should bring feeding pump. So when I told nurses from the NICU that I want to feed Anaya with express milk, we was more than happy. We said, okay, bring us your gold liquid and we'll give to Anaya. So I believe when she was like day number 2, we gave that little bit, like it's like few mils of express milk, which I believe was Jeanette who gave first, and we have a picture. So Jeanette was the first one who started to giving medications her through the NG tube and milk, and I was that chicken who's scared to do everything medical. So when she woke up from sedation, I wanted to start breastfeeding, which doctors was fine with that, but Anaya didn't have sucking reflex, so she couldn't suck. So that one didn't work well. It was very stressful for her. It was very stressful for me that breastfeeding, training, teaching, learning, or whatever experience was very, very stressful for her. She was fighting like so badly, and for me it was stressful as well. Even I was trying to calm down, like it's my dream to breastfeed, but unfortunately it didn't happen. And doctors didn't allow to give her bottle because they said maybe she has unsafe swallow, she can choke on it and all that things. So we didn't give her bottle until she was transferred to another hospital. On the day number 1 we started giving her bottle, which she been in that hospital I think so for about 2 weeks there. So we was giving bottle every single day, so she was having little by mouth milk. It was like very small amount, just to simulate and train her. So she was getting bottle from 5 weeks old and onward every day. So she was getting very little amount, about 10-15 mils in one go. And then when she was 7 months old, we started to give her purees, because I heard that sometimes kids can manage purees better because we can feel purees better in the mouth. It's not that liquishy. So I started giving her from 7 months purees. And when she was 10 months old, after 3 months, she had swallow study. So a child sitting on a chair, an X-ray is next to the mouth. We're putting some powder in the food, milk, and the puree. So when the child is swallowing, X-ray can see where that milk is or food is going. It is going to the stomach, or unfortunately is going to the lungs. So Anaya, she has unsafe swallow. So when she's swallowing and she's trying to swallow, her food just jumps to the airway. So her food is going to the lungs. The doctors recommended to repeat test after 3 months. Unfortunately, she's going to be 4 years old next month. We never repeat that test. And still for us is a big question mark if she's having unsafe swallow, and we was giving milk through the mouth and food, blended food through her mouth for about 3 months time. She never had chest infection. She never had chest infection till now. She never had in her life. She has severe reflux. She's vomiting a lot. She has reflux, and she never had chest infection. So far, it's a big question mark how she can have it. Unsafe swallow, which we were saying unsafe swallow kids having chest infection, and she never had. We asked to repeat that test for so many times, and still the same thing. We never got repeated. But that time we stopped giving through the mouth. We were so scared. We were so scared, so we stopped giving through the mouth. Yeah. And when in that hostel, nurses wanted to teach us how to repass tube. So if she's pulling out, or the tube was monthly, so how to insert tube back. So again, I was chicken. I was scared to do that. So my husband, he trained to do that. And for me was the scariest thing to go back home, and I was so scared in case she will pull out tube out, what I'm gonna do, how I'm gonna do, we need to go to hospital. That was the scariest thing. And before giving anything through the NG tube, you need to aspirate with syringe from her stomach to take out from her stomach acid, to check acid levels, and to make sure the tube is exactly in the stomach, not somewhere jumped in the lungs or somewhere in the wrong place. So before every feed, before every water giving, every medication, we have to do that. And sometimes now nothing comes. So that was for me very scary. But when we learn a trick, we was giving a little bit bottle, she's getting few swallow in her mouth, and then we just aspirating, and we can see that her tube is in the stomach because it's giving some acid number. We're getting some strips which was checking exactly what acid level is in the stomach or not. So that was for me the scariest part, to go home. But of course with time everything became normal. Yeah. So believe it or not, she was pulling her tube very often. we're getting up in the morning, her tube is out. Either with all the sticker is out, or either she just touch here by the nose and just pull out. Sometimes happen in the daytime. It's good if it happen in the daytime, because then we can call community nurse who's coming home and help us, not us actually, we are passing tube in, and we are ready to go again back to feed. But if it happened in the evening or weekends when community nurse can't come to home, when we have to go to hospital, and the hospital was such a long wait, we have to give medications, which is epileptical medications, we have to give feeding, and so we have to wait there. So it was like very stressful time with tube, and that he's scared to do it at home. Even he trained in the hospital but said no, I can't do it, it's very hard when you're doing on your own child. So every time when she was pulling tube out, it was for us opportunity to take pictures of her without tube, which we have plenty pictures without tube. Every monthly picture with month sticker we were taking without tube picture when she's pulling out. So before going to a hospital, you know, like I am mommy without makeup, messy hairs and everything, and before going to hospital, when she pulling tube out, I'm applying makeup, taking some pictures with Anaya for memories. It was like, now when I'm remembering, it's like funny. But yeah, for me it was opportunity to have a pictures with Anaya without tube on her face. But we was going to the hospital like this here and there about 6 month time, and then at one point friends was at our home, and again she pull out tube, or sometimes even she's like gagging and throwing up and just coming through the mouth tube. It was like, you will see all pictures, I will put all pictures here. But one time friend was at my home and I said, you know, I need to try to insert tube, and my friend said, no, let's go, we have car, let's go to the hospital, we will insert tube. And we waited there like about maybe 4 hours, and it was already time for her to give feed. So she missed her feed, and her feed was every 4 hours, 6 times a day. So it was crazy. It was really crazy. We was waiting so long, and was at the last point when I knew it. I can't do it anymore. I can't go no more to the hospitals. I need to do it by myself. I need to learn. I need to get strong. I can do it. So when next time her tube came off, luckily it came off not with all sticker, it came off just here, so still tube was stick to her face. So I knew exactly that I don't need to measure how much I need to put inside in her tummy, because I need to check by the bone, by the like, I don't know, like I know how to do it, but I'm not gonna explain now how to check. Basically, okay, I will check. So tube is long, so one tube side you need to touch here, go to the nose, and then go to that bone, and then to see which side it is. So you know that number which you're holding, then that number the same number should be by the nose. So when it's reaching stomach. So that time when she just pulled out through here and still tube was here, I was like so happy that she didn't pull out all stickers. So I was like, okay, I know exactly which number should go inside because it's already sticked. So I was like, let me pull just in tube in, and like hopefully it will be easy and less stressful. So I did that time. I did second time. I did maybe 3 times. When I said to nurse, you know, I did that. And she said, you know, you need to get trained for that. I said, yeah, I know, but I saw so many times, like countless times I saw. So I think so I'm ready to do that. So she came our home with paperwork. Then I did myself in front of her, and she signed papers that I can do it. So from that time I had a green light to do it whenever it's happening, and it was life-changing. It was much easier. Before we were scared to go out of the city in case she will pull tube out, how we're gonna go to the hospital, how we're gonna go for holidays. So it was much easier life when I learned how to repass a tube. Also, I want to mention something about breastfeeding, expressing milk part. So we started giving her express milk from her first days of her life, and hospitals was amazing, was very supportive. So she was in 2 hospitals. actually not 2 hospitals. She born in one hospital, which we trained me how to stimulate, but I could have milk. Then she got transferred to another hostel where I stayed there as well. They transferred me there. So there in Nico, it is expressing room where there it is expressing pumps. We're giving you to every mom, of course, like it was like 3 or 4 expressing pumps, and moms having their own individual parts which we're using on the body. So we're having it with them, and then after expressing milk, there was a microwave and sterilizer and microwave, which you can sterilize your parts, feeding expressing pump parts. It was very handy. And at the same time, nurses we was giving bottles where to express, and then after expressing, giving to nurse, and we're putting in the freezer, and we're storing there, and then we're giving to a child. So it was very supportive about that. Even we was giving bottles to take home and to express at home. I was lucky I had plenty of milk, that it was enough which I expressed at daytime while I was in the hospital, and when I was expressing in the morning and nighttime at home, I was keeping in my freezer, and my freezer was insane, all full of milk. So I had a lot of milk. I was lucky in that of point, like really lucky. So Anaya was having milk 6 times a day, 6 times a day every 4 hours. So at the same time, I was expressing 6 times a day for every 4 hours. So it was a crazy journey, but I think it was worth it because expressing milk was the best milk for her. She was tolerating the best. She didn't vomit or anything, so she was really good. And she was having expressing milk up to 1 year old. When she was about 1 year old, of course she need to have more milk. More milk is mean more expressing time, so it was taking so long. Plus her feeding time is takes about half an hour on the top expressing, and 6 times in a day it got crazy. So about when she was 1 year old, she started giving formula. At first we was buying, later on we was giving us ready milk, which she didn't tolerate it well. She was vomiting very often. Then we started getting another milk, powder milk, which again it didn't work properly. Wonderful. So when she was 1 year and a half, she had back operation. So we removed her tube from her face, and we put tube in her belly. So I will show a picture here how it looks. So tube going straight away to the belly. So in the back of the stomach, it is like a ring who's holding a tube from pulling out, and from outside of the stomach, it is a white stopper who is not letting tube to go in the stomach at the same time. And we have to rotate the tube once in a week, but it's not gonna stuck to the stomach or anything. So she's having it from 2018 November, and it's a plan to change it to a button, which is easier. It don't have tube hanging. It's much easier to look after. So plan to change might be in a couple of months time. We will see how it's gonna go. After changing tube was life changing, because life got much easier. We don't need to aspirate to get milk from her stomach, because we know that her peg tube is already in the stomach and it's safe to feed on the go. So when she was having empty tube, we was feeding with bolus feed. So we was holding syringe and feeding in about half an hour. You can't feed very quickly because kid can get sick. So I was feeding about half an hour. So about 1 year, we was holding the tube in hands for half an hour, 6 times a day. When I think so, when we change to 5 feeds, so we was holding 5 times a day for half an hour. When we got smarter, we bought like phone holder. It is there, but I will put picture here. So when we're searching phone holder to the table or somewhere, which we clip her syringe and feeding like this. Before getting Peg, her amazing nurse, she got for a speeding pump, which you can just put numbers how much milk she needs to get, and in timing how long, half an hour, 1 hour, and depend on every child. So was that feeding pump, it was such a life-changing. You just attaching feed to a child, putting numbers how much milk she needs and how long she needs to get that milk, and child can feed. That pump is feeding child, and you can do whatever you want. You can wash dishes, you can do whatever you want. Basically, it was life-changing. Yeah. And now she can get up to 2 spoons a day orally for stimulation. So she's getting sometimes some food, puree, sometimes sweet, chocolate. She's not getting real food, like not sweet food. She's getting just something for stimulate. We're having a swabs to swab her cheeks. It's more for hygienic, but at the same time stimulate. She has oral version, which she's very sensitive when we're touching her mouth. Even if I'll do like this, she'll be like, see? So she hates when we're touching her mouth. Also, I want to talk a little bit about her peg operation. So she had it more than 2 years ago. When we came to the hospital, it was planned operation. When we came to the hospital, we said hospital is very busy, all beds is full, and probably she's not gonna have operation, especially when she's very complex need child, which we kind of scared to the operation because hospital is busy and left staff. But after waiting hours and hours, we finally took her to the operation, which I was holding her hand while we put mask on, and then she slept, and then I left her. So she had operation. It was very quick operation actually, but then it took some time to be in the recovery room because, as I said, it was all beds full. And then after like almost all day was gone, she got a bed, and I had to leave her with her dad because she had a little sister who was breastfeeding, so I couldn't stay in the hostel, and dad couldn't go with her sister home because I was breastfeeding her, so dad has to stay with Anaya. And then after midnight, Anaya, she got in distress, started crying, and usually when she's crying, like really crying, her fingers get bluish. So doctors got scared, as I said, because of her special needs, so we were scared. So what we did we sedate her and we intubate her. Was very scary for us as a parents. And as we believe, she got distressed because she was in pain. She didn't had medications for a long time, and that's why she started crying very badly of pain. And because doctors were scared what's happening, so we yeah. So she was crying of pain, and doctors, because we didn't know her and we scared of her complex needs, we just sedate her and intubate her just in safer side because of course we don't know her. And then next we were transferred to another hostel, which was like more intensive, like kids ward, which was like far away. So Jeanette was stayed here with her all the time. And after I think so like 48 hours we started weaning off medications, and then she woke up. And when we transferred to our nearest hospital, where I could come to see her, so I was stay with her and her little sister in the hostel at daytime, and her dad stay at nighttime. So she stayed in the hostel, I think so about 1 week time. And then when she came back, everything was fine then. Yeah, we're back to normal. Yeah, but that experience was really scary. Like, it's hard to remember, but we know everything is fine now. Yeah. Yeah. Yeah, mama crazy. Mama crazy. Is mama crazy? Oh. Anaya, can you give high five? Can you give high five? You're giving, but your hand is like down. You need to give. Yeah! 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 So also she is feeding right now on the special milk which we're getting from Anayas. We're getting every month that milk. So we're not buying syringes, we're getting everything for free, which we are very grateful for. We are hoping in the future to give Anaya blended food through her peg, through her tube, not peg, through a tube. Hopefully she will tolerate better, her reflex will be better. And yeah, we're looking forward. So I hope so you liked this video. If you have any questions, leave below. And see you soon. Bye!